In this video, I'm going to be reacting to this doctor's video about how to scientifically increase your penile length. Is this going to be good? Is this going to be comprehensive? And oh my God, is a doctor actually going to agree that penile traction works? Well, let's find out. Okay, so here we are. This is Dr. Rena Malik. She is a urologist. She has a very popular YouTube video. She has over 1.3 million subscribers, so very popular. So yeah, this is also a very popular video. Look, it got 26 million views. So yeah, let's see what she has to say.
Number one question I get on my social media is, how can I get bigger? How can I get longer? Or how can I get more girth? Well, today I am going to address those questions and give you the evidence behind penile lengthening treatments. I'm Dr. Rena Malik, urologist and pelvic surgeon, and a urologist is a doctor who takes care of the genitourinary tract, both medically and surgically. If you like what you see here, make sure you subscribe so you can see new videos each and every Monday. 50,000 heterosexual men, and what they found was that 55% of them were unhappy with the way their penis looked. When they asked those men's partners, 85% of women were satisfied with the way their partner's genitals looked. But at the end of the day, it matters how you feel about your appearance. But there's a lot of issues with that because pornography has really blurred the lines of what exactly is normal. So I made a video previously talking about the average penile length. And average penile length, if you look at all the data, approximately the average penile length is about 5.2 inches or 13.2 centimeters. And it's
Yeah, by the way, that's bone pressed. So when you're hearing about 5.2, I've read that it's actually 5.5. My personal theory is closer to 6, but we'll go by what she says. And we all know that the studies, they actually have a standard way of measuring with it, which is using bone pressed, because bone pressed does not take into account the body fat percentage that each individual has. So it's a very standard way of correctly measuring the penis across different individuals of different body weights and body fat percentages.
Normal for penile length to be within 2.5 standard deviations of that, so either greater or smaller. And so what's considered abnormal in terms of length being too short would be anything less than 2.9 inches or 7.5 centimeters, and that's called micropenis. Micropenis is prevalent in less than 1%, actually 0.14% of the population.
So I've actually come across girls that say that they've actually seen a micro penis, and it's brutal, what they talk about these guys. So one girl that I hooked up with, who complimented me, she was like, yeah, this one guy that I hooked up with, he had a micro penis, and we were actually friends for a long time. I actually finally gave him a chance, and his dick was like, I was like this, and she was like, no, like half of your pinky. I was like, what the fuck? That's sad. That sucks. I wonder why that happens. Maybe it's a lack of DHT in the mother's womb, whether it's environmental factors. I don't know why that happens, but it's very interesting and very sad.
So it's extremely rare. It can be due to a number of causes, which can include congenital abnormalities, hormonal abnormalities, previous surgeries, or cancer. But today we're going to talk about people who have a normal penile length. So while it is true that the large majority of people who are concerned with the size of their penis have a normal penile length based on these numbers, the true issue is that a significant portion of men can have distress related to the idea that their penis is not as long as they desire. And this is a form of body dysmorphic disorder, actually has a term, it's called small penis anxiety. It doesn't mean that they have a small penis, but they have anxiety related to the fact that they believe that the size of their penis is not long enough. And the way this is defined is that people have a preoccupation or obsession of the size of their penis, which they spend over 1 hour a day thinking about this, and actually some portion of these men can be so distraught that it can affect their activities of daily living, and some of them can end up in the hospital due to their overwhelming obsession or even have suicidal ideation. This is not a joke. This is serious. This can have real serious complications for people. And so I think it's important to talk about this because this is part of men's health. The other main
Yeah, I mean, I think she's dead on. I think this is why, people with Peyronie's, it's very devastating, right? Because the Peyronie's actually, Not only does it cause curvature, which can, in certain men, it's very extreme and cause issues with even being able to have sex. But also it's very distressful, and definitely, you can have some suicidal thoughts for sure.
Major issue with this problem is that if you Google, how am I going to make my penis longer, you'll be inundated with tons and tons of websites and information that may or may not be reputable. Many people will go abroad or find non-licensed providers to do things to them that can have dramatic consequences. So please don't do that. Look for a reputable urologist, psychologist to help you with these issues.
Yeah, she's dead on. I mean, I've heard of guys going down to, TJ Tijuana, to get like all kinds of weird fillers like silicone and all kinds of crazy shit. And while I've actually seen some good results, it's just something you don't want to take a risk with. There's people that have actually gotten their dick cut off because these things get infected. These doctors, quote unquote doctors, end up injecting things that are just not going to actually be tolerated by the body, and the body rejects it. You get an infection, and yeah, your whole thing has to come off, which really sucks.
I will also preface the rest of the information that I'm going to share on this video by telling you that the Sexual Medicine Society of North America states that procedures for penile lengthening or girth enhancement are not recommended and considered experimental unless they are in context of someone who has a micro penis. So the things I'm about to tell you are in the literature for urology and have some data to support them. However, before doing any of these things, please establish care with a urologist who is familiar with these things. As a caveat, I do not discuss or offer treatment for penile lengthening in my practice, but because this is such an important topic, I went ahead and did the research for you guys.
Yeah, and I went over one of the studies in a different video, like how to make it longer, so you can look up that video. But one of the best treatments that I've seen for micropenis can only be done before a child reaches puberty, like during early puberty or even maybe middle puberty. The more further along you are in the puberty stages, it's less effective, and that's using DHT gel. It also depends on the condition. So there's two conditions that can cause a micropenis in boys. One is the pituitary gland, right, which is in your brain, and essentially that causes your body not to produce testosterone. Your body can still convert testosterone to DHT, which through a process called 5-alpha reductase. But for these kids, essentially the problem is their bodies couldn't produce testosterone. In those cases, the doctors administered testosterone, and that actually improved their penile length significantly. And this is because those kids, those patients were able to convert that testosterone to DHT properly. The second type is where the children actually had testosterone, but their body is not able to do that 5-alpha reductase transformation of testosterone to DHT, and therefore their body was lacking DHT. So ultimately, DHT is the key hormone, the key enzyme, for the penis to actually grow, both when you're in the womb and when you're going through puberty. So I've heard a lot of different people prescribed say that it's okay to prescribe finasteride to a kid that's going through puberty just because they're losing their hair. I'm like, fuck no. Like, are you kidding? I don't think they're properly being able to separate the studies and the conditions. Again, one is a lack of testosterone. Two is a lack of the conversion. So either way, doing something like a DHT, something that blocks the conversion to DHT during the puberty stage is extremely dangerous. And there's cases where you can be going through puberty as late as 22. Okay, like if you look at the data. So personally, I would never ever recommend for anyone below the age of 22 to take something like finasteride. Personally for me, I would rather have a normal dick than have like great hair. Like, it's just not worth it. You can always do a hair transplant. There's all kinds of different things that you can do once you're past puberty. It would have to be an extreme case, and you would have to be happy with your current penile length for me to even consider like saying you should take finasteride at such a young age. But yeah, that's one of the best treatments for a micropenis that could only be done when you're when you're going through puberty.
There are two categories of treatment options available to people who suffer from small penis anxiety or distress due to the belief that their penis is smaller than normal. And for those people, there are non-surgical treatments and there are surgical options that are reported in the literature. Starting off with non-surgical treatments, psychological counseling. So there are validated measures and questionnaires and assessments that can be done to help you understand what normal penile size is and also help you deal with some of these anxious feelings. Interestingly, when you look at people who've undergone just psychological counseling and nothing else, the large majority of men no longer want to look for any other treatment, whether it's non-surgical or surgical, to enhance the length of their penis. So this is big. I would recommend anyone who's suffering from anxiety to please seek out psychological care to help you with this anxiety.
Yeah, I mean, I think she's dead on, right? Like, I think in most cases, it's more of a psychological issue where you can have a normal penis, and I think most girls will not care. You know, I'm gonna be a little bit red pill here, and like, this is why you kind of want to marry someone that's like young, right? Like you're in your 18. The studies say that people that have only one sexual partner, their marriages last the longest. And so, you know, you probably want to just find a girl that's only been with one sexual partner. After that, the studies say that, you know, once after like 10 partners or so, things kind of stabilize and it doesn't really matter. But, you know, I would say like if you don't want that bothering you, you probably want to find a girl that hasn't been exposed to a large array of penises. And that will probably help psychologically. But I think for the most part, like girls, they won't really care, right? But they will think about it. So I think it's just something to kind of keep in mind. But yeah, I think like, you know, even though I'm, you know, if you saw my video with with that Mario guy, where he's like saying like, guys, it doesn't really matter, and I was like, oh, that's just cope. Yeah, but it's a good cope. You know, I think like psychologically it's fine, and if you're happy, then that's ultimately good.
There are three other non-surgical options. One is penile extenders, two is vacuum erection devices, and three is penile injectable treatments. The only one of these three that has any data to suggest it actually results in penile enhancement, as in length, is specifically penile extenders. And penile extenders are essentially a device that has a hole in which you put the penis as well as two.
Why does she have to show this one? This is like the worst type of device. Come on, come on. Like you're a doctor. Like please don't encourage people to use this. This is the same device that Mario guy used. This is a horrible type of device. Fucking, you know, made in the fucking Middle Ages and shit. You basically strap your dick on, and you choke the head of it. You it constricts blood. It's very just it's not as ideal as it could be. I highly recommend using more of a vacuum cup device. This is a horrible device to show here.
Metal rods on either side and then a silicone circle at the end to hold the glands in place. And it slowly and mechanically applies traction to the penis to provide length. And it does this over a course of many months and with a lot of time dedicated to it in each day. And when you look at the data, people who religiously used these penile traction devices actually did gain some length on their penis, and they measured their penile length by a flaccid length as well as a flaccid stretch length. In urology, we use a flaccid stretch length to estimate the size of an erect penis.
Yeah, she's right. So when it comes to measurement, and also she didn't mention bone press, but it's actually what they're talking about in the studies is bone press stretch flaccid length, which in all studies actually directly correlates to bone pressed erect length. So it's essentially the same. People that just like say, oh, my flaccid is longer than my erect and whatever, like it's just they're not measuring it right. Like it's scientifically proven that it's essentially the same type of measurement.
So the flaccid stretch length has actually been compared to the erect length that has been shown to be very similar for measurement purposes. So what was the end gain after months and months of daily use? About 2 centimeters. So there was a gain.
No, I mean, if you look at the Penny Master Pro study, which actually so used the Penny Master Pro. People used it. The guys used it for I believe 6 months, 6 hours a day, and they achieved gains of 3 centimeters, and that's only 6 months.
However, it was very, very small. So you have to be extremely compliant, do this daily for several hours a day to achieve the desired effect. Also, there are some complications. This can include numbness, bruising, or overall just lack of efficacy. You can spend a lot of time doing this and see no benefit. So this is the only thing that has been shown in the literature to have consistently good results.
Yeah, I mean, I think she's being oversimplistic. I get it. I get it. Like, she's a doctor. She's not supposed to really encourage this. But if you look at the studies, like, it's the lack of efficacy was because the guys just weren't wearing it enough. The numbness was because they were wearing the ones with the strap. The studies that used the ones with the strap for too long didn't let the blood circulate. So yeah, I don't think she's being very thorough here, unfortunately.
Results with very low side effects. The other options, vacuum erection devices specifically, did not increase penile length at all. And
yeah, absolutely. I mean, that's what the studies show. Like, vacuum erection devices are not for penile length. I don't know. I got to look this up, and I'm gonna make a video dedicated to this about what vacuum erection devices do for girth. And it's my theory that it's marginal, but it's especially for people with Peyronie's, like, it's significant. For me, like, the thing that really did the most for me personally for girth was injections of PGE1 about every like I would say like 5 times a week, 4 or 5 times a week, and that I saw a lot of improvements in girth. And again, I'll make a dedicated video on that.
Lastly, penile injections. There are a number of different penile injections out there that have been tried, used, and many of them have had devastating complications. So I do not recommend doing any penile injections. In fact, next week, I'm going to be talking a little bit about the history of penile injections.
Yeah, I'm gonna look up that video and react to it, but I don't think she's entirely right here. Maybe she's just looking at antiquated studies, but things like PRP, things like hyaluronic acid, like, these are things that actually have been shown to be safe and effective because they're using your own blood. They basically spin it, and in some cases they add like fat to it, and these are very safe, but they're not effective in terms of lengthening the penis, and they're safe. But what she's talking about are things like silicone and all kinds of other fillers that they use. So I get it that she wants to discourage people to get these fillers, but there's really those two types of pill, like a PRP and hyaluronic acid, that are safe. There's some very good reputable doctors that actually use these, but again, it's going to only increase your girth. It's going to do it significantly. It may increase your flaccid length just because you have this filler, and it's allowing you to have like a hang, like you're just resting a little bit longer, but your erect length is not going to change at all, and also your body's going to ultimately absorb that liquid and that filler, and it's going to go back. So they're also really expensive, and they last, if I recall correctly, about a year or so, so you got to keep doing it. I don't think it's something I would consider or do. I've heard that PRP can actually enhance your erections because it's stem cells, right, and kind of rebuilds a lot of the mechanisms in your penis, and I'll make a dedicated video on the science of that. But yeah, I just think she's kind of look at old studies, but she's being safe, right? She doesn't want guys just to go and like inject random shit into their dicks, which is a good
Injections.
thing. Hey, if you like this video, please make sure you comment, like, and subscribe to help support this channel. Now let's keep going.
And what types of penile injections people have done with good results, bad results. Again, right now the data is not strong enough to recommend any sort of injection in the penis. And as I mentioned, you can have devastating complications up to 40 years after getting a penile injection. So please do not inject anything into your penis.
Yeah, I agree. I mean, she's talking about fillers. She's obviously not talking about something like Prostadil or Trimix, which are perfectly safe and are actually, FDA approved and prescribed by doctors. So she's talking here specifically about fillers.
As far as surgical treatments, a lot of different surgical options have been discussed and written out in the literature. One of the most common ones is a suspensory ligament incision. And what that is the penis is held to the pubic bone, which is the bone shown right in front of your penis by a ligament. And by releasing that ligament, you can give a little bit more length to the penis. However, this is not without complications. There are also a number of other techniques using different flaps, grafts, and even using rib cartilage to help increase the length of your penis. And all of these overall have poor outcomes with poor satisfaction.
Yeah, so this I talked about this in my how do you increase the length of your penis scientifically, right? We talked about the sliding technique, grafting. Grafting is for girth, which I'll talk about in my girth video. But yeah, those are I mentioned in the video, right, that the sliding technique, because it's a degloving approach, can actually cause glands necrosis. I also went over the study of the non-degloving approach, which is actually a lot safer, but it's still extremely dangerous. And so, if you look at some of the famous doctors that do this, there's a guy in Brazil that's very world famous for doing this, and he does like the non-degloving approach. He like pioneered all of this, and essentially he does like diamond cuts in the penis, and then he might do like grafting to kind of provide more of the like architectural support structure to it. But yeah, you can have devastating results, specifically glands necrosis, which means the head of your penis is gonna get necrotic, and they have to cut it off, which is devastating.
The studies that have actually been able to give results on these particular surgeries have not been really rigorously reported. So at this time, we cannot recommend a surgery to increase your penile length that is not without a multitude of complications. The only time that you should proceed with any surgery for penile lengthening would be in the context of a clinical trial. And what is a clinical trial? Well, a clinical trial is one that is done at an institution where there is an institutional review board, or IRB. What that IRB does is it makes sure that any study that is done in that institution is safe and ethical to be done on human patients. They also make sure that there is data monitoring and a way to report adverse events that occur during the trial on a regular basis, so that things that happen because of the surgery are accurately documented, and then those things are published in the literature so that you can get true, clear, and complete data from a study that's being done on a certain type of surgery. And so that we as urologists can say, okay, this has been done in 100 patients and only 10 of them had a complication, and that was minor, compared to 20 of them had a horrible complication, and then this is not safe for us to continue doing.
So I'm surprised she didn't even mention Peyronie's, right? She didn't even mention there's different types of surgeries that you can do specifically for Peyronie's, everything from plication to grafting, to just relief incisions, right, to all the way to the sliding technique. So I'm very surprised that she didn't mention this. There's actually some studies from reputable U.S. Doctors and institutions. But in general, I mean, I don't know if you want to go into a study for just something like this. It's very experimental. So I personally would never ever recommend any surgery at all, regardless of whether it's a study or not. And obviously, she's talking about the U.S. Definitely don't want to go to another country to get any of this stuff done. Maybe like if you're crazy enough and you have Peyronie's, you have a severely shortened penis, there's again the doctor in Brazil who's like world famous for it. He pioneered it. But again, it's a big risk.
And this is the way that we start looking at data scientifically to make sure that it has good outcomes and is safe for people to proceed with doing. Bottom line, there's not a lot you can do to change the length that you are given. You can gain a small amount of length with penile traction therapy, and that has been shown in the literature. However, there are many other things that are currently under investigation and are not recommended for routine care. I think first and foremost is getting treatment under the care of a psychologist to deal with this anxiety before doing anything that may be irreversible and have you end up with something that is disfigured, not functional, and worse than what you started off with. Thank you so much for watching, and make sure you join.
Okay, so I mean, I think she played it safe, right? Whether or not you consider 3 centimeters to be significant, right? Like that's over an inch. To me, that's significant. Like, it's a difference between, right, like, 7 to 8, and that's only with 6 months, right? Like of the data. So you would imagine that if you do it for even longer, it will go even longer. So she has a big audience. Obviously, she wants to make sure that the people that are watching her remain safe. So my channel is a little bit more niche. And so, I give a little bit more of a nuanced look at all the studies. So I think she played it safe here. Oh, okay. So there you go. So again, I think she played it safe. In my personal opinion, I think you gotta trust the science and believe that traction does work. At the very least, it's a scientific fact that penile traction done for 6 hours a day for 6 months will increase your penis to 2 to 3 centimeters. And so more so in my opinion, right? Like you can do it for longer. So if you want to get that fucking Pete Davidson dick and have girls talk all about you, like it's just, I don't know, that's kind of like was my goal, and kind of what my channel is all about. So anyways, if you like this reaction and if you learn anything from it, make sure you comment, like, and subscribe right now to help support this channel, and I'll see you next time. Peace.